Hi, I'm Dr. Carolynn DeBenedectis, and I am a breast imager at the University of Massachusetts Medical School. And I'm here to talk about my virtual pearl for the AAWR, which is passion. I definitely think it is so important to do what you're passionate about. I think if you're passionate about it, you're going to be so much more successful. When I started my career as an attending, I had been hired to be a breast imager and to help start their breast imaging research. And I really wasn't enjoying doing research in breast imaging. What I really enjoyed is working with residents, and I really enjoyed patient care. And I went to my chair and I said, I'm just really not enjoying doing breast imaging research. I'd really like to teach residents how to communicate effectively with patients. And I'd like to create a whole training program about it. And I thought he was probably going to laugh at me and be like, well, that's not the job you were hired for. But instead, I was very fortunate, and my chair supported me fully and actually thought it was a great innovative idea. And it was the springboard for me to do really interesting things that I was passionate about instead of doing what I felt I should do. And that's led me to women in radiology and diversity and inclusion to radiology, things that I'm super passionate about. And it's much easier to spend extra time outside of a busy clinical day doing things I'm passionate and excited about, rather than, for me, looking at breast imaging data and things like that, which I wasn't passionate about. It was really hard for me to get excited, but now I get excited, and I don't mind if I'm up late reading about women's issues in radiology or talking to the ABR board about extending parental leave for residents. And it gives me a lot of job satisfaction, and it makes me want to write more papers and want to do more research and want to get more involved versus feeling like I have to. So I guess my biggest pearl is to make sure you're doing what you're passionate about and what you love, and not just doing things because you feel it's what you should be doing. And don't be afraid to talk to your chair and talk to your division director or whoever it is and say, hey, this isn't what I want to do, but there is something else I want to do, and I'm going to be great at it. Because I think that if people are doing what they love, they're going to do a much better job at it, be much happier, and actually be more successful. And I know my chair uses that philosophy, and I use that philosophy with my residents. So go forth and do what you're passionate about.